Welcome back to Healthwise. With me is Dr. Gabrielle from Opelousas General Health Systems. And we were talking a little bit about where she was from and how did she end up in Louisiana. But now we're going to talk about the real big O, which is obesity in Opelousas and Louisiana area, whole Acadiana. I think most people either they suffer from it or they know someone that suffers from it in this area, and it's because, just as she was talking about earlier, the food is so good in this area.
That's true.
That everybody just ends up eating and eating and eating, and it's all the kinds of food that causes us to get obese. Well, Doc, tell us a little bit about it, and you know, maybe some ways we can stop it, or just whatever you want to talk about as far as obesity.
Yeah, sure. Usually the main problem we have been seeing much more in even developed countries and even poor countries. There has been an increased rate of overweight and obesity, and it's quite alarming. It's there's also some countries that they have undernourished people suffering with nutrition, malnourished, and also in the same population, the same country, we see also people who are overnourished, overweight, and obesity. So it's quite paradoxical. I think most of the cases of overweight and obesity can be prevented, but it has to do also not only kind of like create conscious on the population. It has to do also with the government to kind of give better awareness and much more help to those kind of people. Usually what we're seeing is that the more overweight and obesity continue growing, we're seeing an increased incidence in diabetes. And by diabetes, I'm mainly referring more like diabetes type 2. What happens is there's different types of diabetes, but the diabetes type 1, it's mainly when your pancreas doesn't produce any much insulin. It's much more like an autoimmune process. So your body needs insulin. So that's when they start self-injecting themselves using insulin to kind of survive. The type 2 diabetes, it's much more seen in overweight, obese population. And it's actually 90% of diabetic population are diabetes type 2. And most of them, they do require basically having diet, exercise, and also, you know, might need oral medication to keep their diabetes under control. But it's much more preventable. We would say that diabetes type 1, it's much more easy sometimes to diagnose because the patients might come with having altered mental status, having increase in thirst, increase in urination, and they can even progress to having coma and even death, meaning that they don't receive the proper treatment or the insulin. Right. Type 2, it's a little bit much more silent. It's kind of hard to make the diagnosis because most of the people, they come in having with a complication, either a heart attack or an unhealed ulcer in their foot. And then when we checked on their blood sugars, we see that they're off the chart. And we diagnose, you know, right there that patient is having diabetes type 2.
Okay. Doc, for the audience's sake, let's also, I guess, a little clarification on that. Type 1 diabetes is the one where they're taking the insulin shots, or is it type 2? Is that?
Well, actually, type 1, they're mainly insulin dependent. They will need insulin no matter what. Type 2, they can have oral medication, the tablets, correct, and also they can have insulin. Okay. Sometimes they are diabetic type 2 for many years that they've been not well controlled, and they would require having type 2, and they kind of, require having insulin. And usually they would have what we call more like a late adulthood onset of autoimmune, kind of like a type 1 diabetes when they later on require with the insulin.
Okay. I know, you know, you also said about the ulcers, which we call on the ambulance, you know, a lot of times in the medical field, we'll call it decubitus, which pressure ulcer or whatever, and these don't heal. And that's a lot of times, like you said, that's how they know all of a sudden they have some sore that doesn't heal, and then they know they have some type of
Or even the eyesight, something as simple, they start complaining of having problems with their vision, blurry vision, and when you go ahead and check on their blood sugars is probably more than 300.
Right. Okay. And it's really important to know that this is caused also, like you said, by obesity.
Correct.
I mean, it's an outlying effect that obesity causes this. What would you say that, I mean, or does it look like in the years that you've been here, does it look like we're getting an increase all of a sudden in obesity?
Well, I would say that compared to, there hasn't been like a direct study like saying if the overweight population has decreased or anything like that. But when we go back like more in the 20s and 30s, there is definitely a increase, having much more overweight and obesity population. And even when they have done studies on people who already have diabetes, especially diabetes type 2, they have seen to have like a mean body weight, body mass index of 31, which is actually classified as obese. Right. Usually, I think people are more aware of the problem, and people are much more prone to going to their primary care doctor and say, hey doc, I really want to get checked, because probably they had a family member who was recently diagnosed with diabetes. Also, they come with the common symptoms of course, for having diabetes. I would say that the problem is that the more developed the country is, and also the population keeps growing, if they don't have a sense of awareness about the proper way to eat and having a much more healthy and balanced diet, it's going to be hard to control the alarming incidence increase in obesity or being overweight.
Okay. Doc, okay, so when you have a patient that would come into you that would be not necessarily, I mean, we'll talk about the if they're not just obese, but if they're diabetic, we'll talk about that, but later on. But what would you tell a person that would come into your office that would be obese? What would be, I mean, is there some regimen that you put them on or whatever?
Oh yes, sure. If I have a patient that come and visit me with that kind of problem, I would usually advise them, kind of sit down with them and kind of say, hey, tell me what is your regimen? What exactly did you eat? What do you know? What you like, what you don't like. Usually I would test them. Usually there has been a lot of different point of views about screening, but usually the ADA, that is the American Diabetes Association, they do recommend people who are already overweight and obese and also having family history of diabetes or having high blood pressure, especially more than 130 over 80, to be tested for checking on the blood sugars. We can either do a fasting blood sugar check, or also we can do what is called the hemoglobin A1C. There's also postprandial testing, meaning that you give them like a load of glucose and then you check after 2 hours to see how that blood sugar is. Okay. So I would actually kind of assess their risk factors, check if my patient is truly a pre-diabetic or more towards having already the diagnosis of diabetes. So that would change a lot my treatment course, especially if they're pre-diabetic or diabetic. I would definitely focus on lifestyle changes. I would focus on diet, exercise, and I would kind of closely monitor that patient for their weight, because at least I would expect that patient to, if they're in a healthy ADA diet, that's the diabetes diet, they should at least be able to lose 4 to 5% of their weight after 1 to 2 months of doing like just diet. Okay.
All right, Doc. Well, we're going to take a brief break for our sponsors, and we'll come back and we'll talk some more about the topics we talked about.
Okay, thank you.